EBRT tool, dentists can take bite registration records at the time final impressions are taken. No need to wait for the lab to fabricate bite blocks, thus saving time by eliminating one appointment. EBRT is utilizing Gothic arch tracing, which gives more accurate record than a bite block. First, take an orientation impression on the upper and lower arch. Impression does not need to be deeper than 1 to 5 millimeters. This impression is for trace to stay in the mouth at the same place and for lab to mount them to the cast. I use medium body impression material like Splash by DentMat or Aquacil Ultra Monophase to take impressions. These impressions can be taken by the auxiliary team. Once you have impressions of the maxillary and mandibular arch, place pen in the lower tray from gums up so that the marking bow is facing maxillary and will be in contact with the marking surface of the maxillary plate. Rotate the pen to vary vertical dimensions and have the patient lightly close and verify the vertical dimension is correct. Repeat until this is achieved. Once at VD, the patient and doctor are comfortable with, practice with patient's protrusive and excursive movements. Remind them that they do not have to bite hard. Light pressure is sufficient. Take upper tray out and dry it. Spray, occlude, or use a charcoal pencil to mark the tracing table of the maxillary plate so that the pen can mark the tracings. Place back into the mouth and have the patient make protrusive and excursive movements to get the tracings. Take out the upper tray and read the tracings. Place a small indentation with a round burr number 4 where all 3 lines meet. Place the tray back into the mouth and have the patient find the indentation that you made. They should feel the pen fall into place. Check for interior and posterior rotation of maxillary arch. If rotation is present, stabilize by hand. Fill the space between the 2 trays with bright registration material of your choice. Have the patient close their lips. This will give you a lip line. Mark midline and remove the record from the patient's mouth. You have a record ready to be sent to the lab.